Good morning, everyone. Thank you so much for joining us today. My name is Alex Hess. I'm a lawyer and the legal training manager at the Center for Public Health Law Research. We're based out of Temple University in Philly. And today I'm going to be talking with you a little bit about legal epidemiology. If that's something you're not familiar with, we'll dive into sort of what it is, why we at the center believe it's so important and critical to public health and health equity. And I'll talk a little bit about legal epi and ways our data that we produce at the center has been put to use, specifically from a sexual and reproductive health perspective in light of today's National Public Health Week theme. And I'll, of course, be talking about the resources, some of the many resources that we offer at the center if legal epidemiology is work that you're interested in learning more about or in doing yourself. And like I mentioned, please feel free to use the Q&A if you have any questions. And of course, we will have our contact information if you have any questions after this session or would like to reach out to us about legal epi or other questions about the work we do at the center. But before we really kind of dive into legal epi, what that is, why it's so important, I kind of wanted to take it a few steps back and talk about law as a social determinant of health. We know that law shapes behaviors and environments, and that it does have impacts on health and health outcomes. But we also know that historically, law and policy have been sort of under-evaluated in terms of what their actual impacts are. And so we at the center support the widespread adoption of scientific tools and methods for mapping and evaluating the impact of law on health. And so we do this by way of legal epidemiology, which is sort of one facet of legal mapping. And so these are sort of two different buckets that you can think of when you kind of think of public health law research. There's the sort of more traditional side of that, which is public health law practice. That's where, using more of those professional, traditional legal skills in the development of health policy and the actual practice of public health. And then on the other hand, we have legal epidemiology, which is a much more rigorous approach. It's the scientific study and deployment of law as a factor in the cause, distribution, and prevention of disease and injury in a population. So when we sort of approach a question of public health law and we want to embark on a research project, I think it's important to kind of start with what the goal is. The goal is to be able to sort of do evaluation and to really understand the law's effects. That's where legal epidemiology comes in and is so useful. It, of course, does require more resources and can be more time intensive. And that's because of the rigorous approach and because quality control is embedded at really every step of the process. And that's to ensure reliability and replicability with the data, as well as transparency. And this table really kind of breaks down the differences between public health law practice and legal epidemiology a bit more. I won't dive into this too much, but you can see from those first two rows that legal epidemiology encompasses policy surveillance and legal assessments. And that's really when we're thinking about doing policy surveillance at one point in time across jurisdictions or over time. So legal assessment as, again, at one point in time, policy surveillance can track laws over the span of a year or 10 years. And so it's really useful in being able to track the change in law over time. And as we know, laws are constantly changing and it can really depend on the context and maybe the area of policy that you're interested in researching. To really understand whether or not it's important to be able to track changes over time and to kind of overlay that with public health outcomes to see if there is an impact and what that impact might be. Our work is really transdisciplinary in nature, and so we like to think that a number of different stakeholders use legal mapping, from policymakers to be able to actually see the elements of the law that have gained the most traction or movement in other jurisdictions, and to be able to do the same thing within their own communities. Advocacy groups, again, to track the progress of perhaps campaigns or efforts to change laws and to determine where their efforts and resources might best be leveraged. social scientists to access the data and to actually do that evaluation on policies that influence health. And that's, of course, sort of the legal epidemiology piece, government agencies to track the success or metrics of government programs, and also for the public and health professionals as well. So again, legal epidemiology is the scientific study and deployment of laws that factor in the cause, distribution, and prevention of disease and injury in the population. So much like the sort of traditional definition of epidemiology, we have applied this specifically to law and policy. But in order to actually do legal epi, in order to be able to do this evaluation, we need the data first, right? And the process of creating the data itself, we call policy surveillance. Policy surveillance is the systematic collection, analysis, and dissemination of laws and policies across jurisdictions or institutions and over time. So we kind of like to think of policy surveillance as that first step in doing legal epi, because of course you can't do the actual evaluation if you don't have sound, rigorous data, right? This wheel that you see here represents the policy surveillance process. And I'll talk a little bit more about the training and resources that we offer if you're interested in learning more about this process, but it's a wheel specifically because it's a very iterative in nature, and we have quality control here at the center because it's implemented at every step of the process. So we start with defining the scope and really thinking about what the area of law and policy is that we're interested in researching, how it might have changed in recent years, or why is there new developments that we're interested in tracking? Why are we interested in tracking this area of policy? You know, thinking about the end goal, are we using this for evaluation? Conducting that background research to kind of synthesize the information that you've collected, developing your coding questions. So that's really identifying what those variables are that you're interested in capturing from laws and policies to be able to turn them into data, collecting the law and creating the legal text. And that's exactly what it sounds like. You're actually collecting all of the laws themselves and organizing them so that you have them available, so that when you go to do your coding to actually pick out the variables within the laws and policies themselves, you can then code the data or produce the data based on your coding, publish and disseminate, and then continue to track and update as needed. And of course, there's a lot that goes into each of these steps. I'm giving you just a really high level overview of what that process looks like, but these are all the sort of elements that go into the policy surveillance process to be able to create that data. And I think there's a question, will a copy of these slides be provided to participants? I think we can send around a copy of the slides. I know that the recording will be available. I'll double check to see whether or not you'll have access to the actual slide deck as well. But thank you for that question. So we know what policy surveillance is a little bit now, right? But why is it important? Why does it matter? Well, for one thing, our goal with creating this data is for it to be reliable and can be used for evaluation. And that's, again, getting at our rigorously produced data that has quality control built in to eliminate bias, reduce error. Also, part of that is that we're creating accessible nonpartisan information. So of course, this is information that is strictly gathered from the legal text itself. So the data itself is very objective. We can also track change over time and measure progress, which is of course so important when thinking about the nature of laws and policies, how much they're changing across jurisdictions and over time. To also be able to diffuse innovative policy ideas. One great thing about policy surveillance is that it can be used to track policies that are developing in a sort of rapid environment, policies that are newly emerging, that might just appear in one or two jurisdictions that policymakers, advocates are interested in getting a better understanding of to maybe perhaps adopt in their own jurisdiction. So policy surveillance can be really useful in that effect. And finally, to build workforce capacity. this is an example of sort of what the end product looks like. That's, again, that legal data for evaluation, something that's really great with the software that we use, which I'll talk a little bit about in just a moment, is that once you've sort of done all of your coding in the software called Monocle that is specifically created for law and policy surveillance, it sort of spits out at the very end data in CSV format that you don't have to, it automatically inputs all of the variable names for you and includes, the jurisdictions, the effective and through dates, and the actual, coding, which is really great. And you can also download the Codebook, which is the complete list of all the questions coded in a legal data set. So that, of course, includes the question type, the variable name, and the variable values and their labels. So thanks, Hope. So it looks like we'll have the slides and recording available, and we'll let you know once they're available. Thanks so much. And so again, the Codebook and data are both readily downloadable in the software that we use called Monocle, which is a software that our team has developed to support the work of not only our team, but other teams around the world. So from, the CDC, so many organizations who are using Monocle to do their own policy surveillance and coding, to build data for their own research and practice. And the platform applies a question and answer framework, so it's very straightforward and easy to use. And you can also link the actual coding to citations. So it's easy to identify the basis for your coding, and to also be able to, reduce error and integrate quality assurance into this process. Monocle is a very useful tool. That's not to say that you can't use other platforms to do this work. You can also even use Excel or Word using tables, but we use Monocle just because it makes this process so much easier and streamlined, and because this is the work that we specialize in, so we're constantly working on policy surveillance. So if you are interested in that, we have plenty of resources about the software itself. Again, I'll get into a little bit of that in just a moment. We have over 1,000 researchers using Monocle. Again, that's researchers from all over the world. And the data created on Monocle is available on 3 of our websites, lawatlas.org, PDAPS.org, and cityhealth.org. And so we host over 140 data sets that have been created by our staff and also by collaborators on these different websites. PDAPS is the Prescription Drug Abuse Policy System. And we've partnered with a number of organizations and institutions who have also hosted the data that they've produced as well, all using Monocle. So we'll talk a little bit more about Law Atlas and PDAPS, which again, those are our 2 websites. Law Atlas is our flagship policy surveillance website, supported by Robert Wood Johnson Foundation as part of our work. And it hosts over 125 open source data sets. So these are publicly available. You can go onto lawatlas.org now and sort of browse the different data sets that we've created using legal mapping and policy surveillance across a wide number of different policy areas. You can also access training and other tools on phlr.org, but I'll talk about those later on. And then PDAPS, again, Prescription Drug Abuse Policy System, that was originally funded by NIDA, and that is specifically tracking key state laws related to prescription drug law and policy, lots of opioid policy, medical marijuana policy. Data sets are located on PDAPS. And so if you're interested in information on those data sets, you can access pdaps.org. This is just a screenshot, an example from one of the data sets on Law Atlas. I picked this one because we have recently published our update on state preemption laws. So I kind of wanted to highlight that today. But you see here on the left-hand side is the sort of interactive question and answer set There you can filter and explore the answers to the questions that you've created and kind of identify where those particular variables exist in the jurisdictions that you're tracking. You can see that on the right-hand side on this sort of interactive map. So you can also click on the actual jurisdictions themselves to kind of get a better idea of the full coding for that particular jurisdiction. So Law Atlas is very interactive in that way. And again, that's where you can find the data sets that we've created. This state preemption laws data set being one of those. Oops, sorry, just step back here. And I also wanted to highlight that as part of that newly published update for preemption law, we track a number of different domains. I'll go back, you see here on the left-hand side, I know this text is really small, but we track quite a few different domains from ban the box, firearms, housing, policy like rent control, inclusionary zoning, a number of different tax expenditure limits, but also as part of this new update, we are tracking local law enforcement budget preemption, race and racism in school curriculum, specifically focusing on those states that are preempting the sort of critical race theory curriculum, and then finally preemption of trans rights. So I wanted to highlight that work that we've recently published as part of the trans rights, what we call domain for this data set. It tracks preemption on inclusive school curriculum for trans, queer students, gender affirming care, single sex spaces. So kind of those like single sex bathroom laws that we have seen so often in the news as of late, participation in sports, and interference with parental rights as determined by state-related health or mental health. So I wanted to highlight our preemption data set because it was recently published, touches on so many areas of trans rights that are under attack today, specifically as it relates to trans youth and their access to healthcare. Being able to view this data is so important, as we know that these laws are gaining so much traction and popularity in legislatures. It's going to be really important to continue to keep an eye on how they're developing, changing, whether there are legal challenges successfully to any of these laws, and perhaps being able to do evaluation might be important as time goes on. So that's our state preemption laws data set. But in addition to that, I wanted to kind of highlight some of the data in action. So taking the data that we've produced or that others have produced using our methods and perhaps software to actually do legal epidemiology. So like, what does this look like in practice, right? So I wanted to kind of talk about a few studies that have been done using some of the abortion law data that's been created at the center. This study used 4 different CPHLR data sets, specifically abortion provider qualifications, medication abortion requirements, laws on abortion facility licensing requirements, and restrictions on insurance coverage of abortion. So those were 4 different data sets that were created as part of our abortion law database to do this study, which examined the implications of strict abortion policies on birth outcomes in the US. It looks like we have a question. Does the preemption data set capture the variation of the laws? Can we tell from the data set which states have more severe strict laws? Thank you for that question, Rebecca. The data set does capture variation of the laws. So if you can go ahead and take a look at that data set now if you'd like, but I mentioned all of those different domains. This data set was designed, I should say, in partnership with the National League of Cities. The goal was to kind of gain a high level overview of what preemption looked like across each of those domains in all US jurisdictions, so all 50 states. And we do capture variation across each of those domains, and there's quite a bit. You can tell using some of the search functions on Law Atlas which states tend to have more preemption than others. Typically the way preemption kind of shows up in now is that it's limiting public health progress in a lot of ways. And so I think you can, glean from accessing that data where states are being much more restrictive on sort of these public health forward policies. But yes, you can tell based from that data set which states have more preemption laws than others. Thanks for that question. Thanks, Lindsay, for sharing that link in the chat. That looks like the link to our preemption law data set. So sorry, taking a step back to some of this data in action. This research letter was published in JAMA, and it analyzed the results of a cross-sectional data set produced using policy surveillance that identified state laws granting individuals and institutions the right to refuse participation in abortion, so granting immunity from liability for refusing to participate or provide an abortion, and limiting what is sort of called conscience rights when patient safety is at risk. So this is one example of a legal mapping paper, and they wrote about the legal data itself. So this is a great example of sort of synthesizing what the actual data is saying, which is definitely something that policy surveillance makes really easy to do. One other example is this study published in the American Journal of Public Health, and that used data produced, again, using policy surveillance, where we tracked state level minimum wage for each of the 50 states by month from 1980 through 2011. So this data set spanned quite a large amount of time. And based on data from the National Vital Statistics System, the researchers created frequencies and rates of low birth weight, post-neonatal mortality by state and month from 1980 through 2011. So they found that if all states in 2014 had increased their minimum wages by $1, there would have likely been 2,790 fewer low birth weights and 518 fewer post-neonatal deaths for that year. So this is really compelling findings using some of the research that was created using policy surveillance. And then finally, this example using our state earned income tax credit data set, researchers examined the effects of EITC on birth outcomes among those with a high school education or less, stratified by race and ethnicity. And so they found that the EITC at the federal and state level is an effective policy tool to reduce poverty, improve birth outcomes across racial and ethnic subgroups. Given the historically higher risk among Black mothers, state level EITC expansions offer one policy option to address this persistent health disparity. So I think these are just a few examples of the work that's been done using and leveraging a lot of the policy surveillance data that has been created using our methods to really come up with these really important key findings. And again, these are all sort of pertinent to today's theme and thinking about sexual and reproductive health, maternal and infant child health as well. So I hope this kind of gives you a better idea of legal epidemiology and policy surveillance, what they are, how to do it, and why they can be so important, especially in doing research on the relationship between law and policy and health outcomes, as well as health equity. But I wanted to also share some of the resources that we offer, some of the many resources we offer that you can use and access to learn more about policy surveillance, legal epidemiology, or do it yourself. So firstly, our free policy surveillance self-guided trainings. You can access these on phlr.org. I think this is a really great resource to move at your own pace if you're interested in policy surveillance. Each of these methods represents sort of an individual step in the policy surveillance process. You'll see these QR codes are on each of the following slides, and those you can scan on your phone, and they should take you to the actual resource page itself on the corresponding website where they're located. So again, these are the self-guided trainings. These are free that you can access right now, again, on phlr.org, and they go through step-by-step the policy surveillance process. We also offer a non-credit asynchronous course available on Canvas, and that's the Global Certificate in Legal Epidemiology. So this is, of course, much more in-depth than the sort of self-guided trainings. It's 3 self-paced modules that have been developed by our expert staff, so covering the new public health law, really diving into the sort of history of public health law, the state it's in now, and then we talk about policy surveillance, the process again of creating the data, and then finally legal evaluation. So once you have the data, sort of where you take it, what you do with it, and that's really exciting. And so this global certificate we started offering last year, and so it's gained a lot of popularity. If you have questions about the certificate, we'd be happy to answer those for you. We also offer a graduate certificate in public health law research. So this is 4 credit, and again, is covering a lot of the similar topics. So you get training in public health law, legal epi research methods, and it's offered sort of in partnership by the College of Public Health and School of Law here at Temple. And it's in association with, of course, us at the Center for Public Health Law Research. We also offer free monthly webinars, and these introduce both introductory and advanced policy surveillance methods and applications. So we have 2 sort of different tracks, the introductory track, so that's the introduction to policy surveillance that we offer, I think, every other month. And then we also have our Legal Epi at Lunch series. And so these are advanced topics and methods in scientific legal mapping, legal epidemiology. Our last session covered sentinel surveillance. We have one actually next week if you're interested. That's all about monocle, which is really exciting. So we'll talk with our tech manager, Alex Fraser, a little bit more about sort of tips and tricks in using monocle, things you might, if you're familiar with monocle, you might not know kind of existed that you can use to kind of help you along with your coding research process, and also sort of gathering preliminary findings. So if you're interested in monocle, I would recommend checking that session out and signing up for that. I think you can find more information about that on our website. Or again, you can use this QR code to register. And then finally, our Policy Surveillance Institute. This is an annual sort of workshop institute that we offer every year. The past couple of years we've been virtual, but we are now transitioning this year to an in-person format once again. And so that will take place October 5th and 6th, and we will be in Philly at our sort of Temple downtown campus location. So if you're interested in that, I would definitely recommend using the link here to check that out. And that is a great opportunity to learn all about scientific legal mapping techniques. So it's very in-depth, very interactive, learning the policy surveillance process itself, but also in, I think, a much more collaborative way than in, some of the other trainings that we offer, just by the very nature of it being in person, which is great, and kind of getting to work with and meet other folks, network with others who are interested in doing this work, doing research on policy surveillance and kind of better understanding the role of law and policy and its influence on health and health outcomes. So I would definitely recommend checking out more info on the Institute this year. It's going to be really exciting. So this kind of just encapsulates all of the trainings that I just covered. In addition to this, though, I did want to add that we also offer direct technical assistance and support from our staff. So part of our funding from our WJF is to actually teach and train others on policy surveillance and legal epi. So if this is something you are interested in doing or already kind of working on a project, maybe you have questions or you've hit some roadblocks, please feel free to reach out to us. Again, we'll leave my email address, I think on the last slide, our contact information. So if you do have questions as you are doing policy surveillance research, please feel free to reach out to us. We'd be more than happy to help assist you along the way. And again, we have these other trainings that I just mentioned. And I think speaks to training and teaching being a key part of our work, and that we've trained over 3,500 individuals to do policy surveillance. And so I think that's really exciting that so many are sort of gaining this expertise along with us to be able to do this work themselves. That's really a key tenet of what we do at the center, is to not only be able to produce the data that we do, but also to enable others interested in this work to be able to do it for themselves as well. We would love it if you signed up for our newsletter, followed us on social media. The handle's listed on this page. The QR code is listed as well. I also included my email address in case you have any other questions for me after this session, if you'd like to reach out. I can also, we do have some time still, so if anybody had questions, please feel free to leave those in the Q&A. Are most legal epidemiologists lawyers or epidemiologists? Oh, that's a great question. I think a lot of the work that's been done has kind of been partnership of lawyers and folks who do more of the traditional sort of epidemiology research. But yeah, I think that sort of speaks to the fact that this work is so transdisciplinary. I think we get a good mix. I will say that from our trainings, for example, the Policy Surveillance Institute, we have participants who come from all different sort of fields, working in government policy, folks who are researchers, some lawyers. So I think we get a good mix of different folks who are doing this research. Of course, the kind of evaluation itself, I think, requires more experience with doing epi and quantitative statistical evaluation. But I think we've definitely had a lot of participation from lawyers who have the expertise in sort of the policy arena as well. All right. Well, I'm not seeing any, so please feel free to reach out to me at the email address on this page. If you have any questions about any of the material we covered today, questions about policy surveillance, legal epi, any of the resources, trainings, TA that we offer, I'd be happy to answer those questions for you. Again, thank you so much for joining us today to talk a little bit more about legal epi. I hope that this was useful to you, and look forward to hearing from you if you're interested in doing some of this work for yourself. So thank you so much for joining us today.